Hey everyone, this is Jason from Intricate Art Spine and Body Solutions. You can check us out at intricateartseminars.com. Remember, we teach 4 dry needling classes, 3 manipulation classes, and we offer 1 online class at the moment speaking about how to think about dry needling to regulate the autonomic nervous system. And we have another online class coming up about dry needling and how to use it to treat men's and women's pelvic health issues. So today, I wanted to talk a little bit about one of my favorite subjects, which is fly fishing, right? So I was a fly fishing guide in between Patagonia, Chile, and southwestern Alaska for a decade. So I spent 8 months out of the year in Chile, 4 months out of the year in Alaska, and what I ended up doing was I operated the fly fishing lodge and guided down in Chile, and I was just a fly fishing guide up in Alaska. If you guys like to fish or just like to travel in general, those are 2 of the most beautiful places I've been in the whole world. I've been to every country in South and Central America. They're really, really great places. So Patagonia is the southern portion of Chile and Argentina, right? And where I was at in Alaska was southwestern Alaska. So all of those places are awesome. One of the things that I saw a lot when I was a fly fishing guide was a lot of our older clientele would come in with elbow pain, or they'd be fishing with elbow pain, right? So when you're fly fishing, the general motion is like that, right? So you got the line and you got the rod, and you're using the momentum of the rod to get the line out there. So obviously with fly fishing, baseball, golf, another thing that I love to do, lots of different sports, hockey, football, all of them involve the upper extremity to some degree or other, and it's very, very painful when you start to get pain on your medial and or lateral epicondyle, including if you get pain in your shoulder, right? So when I played Division I ice hockey in college, I had 2 shoulder surgeries. I dislocated my left AC joint a bunch of times. I broke my collarbone 4 times on my right side. So I'm pretty familiar with difficulty with casting the fly rod after you've had shoulder surgery, which is a really big pain in the ass, right? So the way that I cast a fly rod now is I try to take my shoulder out of it because my right shoulder especially is still pretty messed up, right? So when I cast, I use almost a little bit of a sidearm casting, and I just try to use my elbow and my wrist. But sometimes that'll start to bother my elbow. And my elbow, it typically bothers me on the medial side, on the medial epicondyle. A lot of people, it'll bother them on the lateral epicondyle or both. So you could have elbow pain combined with shoulder pain, combined with neck pain, right? And none of that is fun to fish with. So as far as treating people that are active, one of the things that active people induce on their own nervous system is sympathetic stress just through the activity of being active, right? So exercise elevates sympathetics, mental and physical stress both elevate sympathetics, pain elevates sympathetics. So just the act of living elevates the sympathetic autonomic nervous system. So one of the things that I think is really important to think about is that as far as human beings and evolution goes, we've only had about 100 years of practice living over the age of 50, right? So if you look at the average lifespan of people in 1900, it was about 50 years old. So what happened? Well, we had a very big jump as far as lifespan goes, secondary primarily to the advance of antibiotics, right? So we had hundreds of thousands of years of human history only living up to the age of 50 or less, and we've only had 100 years of human history living over the age of 50. So that is one, in my opinion, that's one of the primary reasons that so many people around my age, around 40, start to experience problems with erectile dysfunction, which I don't have, by the way, and other problems like chronic pain, incontinence, headaches, balance problems, right? A lot of the reason for that, barring any significant, like specific underlying pathology, like you get in an accident or you break your elbow or something like that, if there's no specific reason for your problem, the high likelihood is that your body has reached its sympathetic upper threshold and your autonomic nervous system has lost the ability to self-regulate, right? So when you're out fishing, if you're doing a lot of this and you're walking around and your elbow and your shoulder's hurting, it can be very, very difficult to treat elbow conditions, right? It can be relatively easy to initially treat them, but I think where people run into the biggest problem is that when you're treating the elbow and the shoulder without dry needling and joint manipulation, you're only tackling part of the problem. So number one, there's no direct muscle treatment without needling. So needling is the only direct muscle treatment that we have. I think primarily in the elbow, the reason for recurring elbow pain, and so many people experience this where they go to therapy, the elbow gets a little bit better, they go back, they start doing stuff, it hurts again. I think the primary reason for that is inflammation of the periosteum. So the periosteum is like the lining of our bone. If you think about the casing of a sausage, right? The casing of a sausage, if the sausage is our muscle, that casing would be the epimysium. If that sausage is our bone, the casing would be the periosteum. So when you hit healthy periosteum with a needle, it feels really hard, like the side of this fly fishing rod, right? It feels like a piece of metal or a piece of carbon. When you hit inflamed periosteum, it feels mushy. So I think that the driving factor for recurring elbow and shoulder pain and headaches and so many other things in the body is inflammation of the periosteum. So periostitis, right? Or periosteitis, however you want to say it. So you can directly treat inflamed periosteum with low frequency electrical dry needling, which is very, very helpful at reducing joint inflammation and periosteal inflammation. James Dunning has done some really good research on this. I think he has one paper called Periosteal Electrical Dry Needling for Knee Osteoarthritis. There's been lots and lots of acupuncture studies over the year and dry needling studies looking at the efficacy of directly placing low frequency, so 1 to 5 hertz microcurrent through the periosteum itself is one of the best ways to stimulate the autonomic nervous system to depress sympathetics and elevate parasympathetics. It's also the only direct way that we have to remove inflammation of the periosteum. So this is something that I see clinically all the time over my last 10 years of practice, is that very chronic, difficult to fix conditions like medial or lateral epicondylitis or rotator cuff pathology become very easy to fix because you can now directly treat the muscles. So if it's your ligaments in your elbow that are bothering you, you can directly treat ligaments, right? So if it's like your UCL or like the Tommy John surgery, what ligaments lack, apparently, according to research, is blood supply, right? So if you can needle in and around ligaments, it stimulates fibroblastic proliferation and collagen deposition, which theoretically will help tighten up the ligaments, and it certainly helps improve muscle firing patterns and normalize joint motion from normalized muscle length and other tissue length, right? So aside from needling all the muscles around the elbow joint, it's very, very helpful to target the tendons and ligaments around the elbow. Number one, because those are the primary things that are really getting inflamed, because we have these big muscles that are crossing our whole forearm and attaching on a little knob, like on the medial epicondyle, it's about as big as your little fingernail. Lateral epicondyle, just a little bit bigger, maybe your first finger. But you have lots of big, strong muscles attaching on a little tiny piece of bone. So when anything gets pissed off, those muscles really start to pull, and they pull on that bone lining, and they pull on the tendon, and they inflame the periosteum. I can't tell you how many patients that have had years or decades of problems that have not experienced either needling at all or the proper dry needling techniques, and you start treating them and their problem goes away almost immediately. It's really, really awesome, right? So for any guys or girls out there that love to fly fish, that have chronic pain really anywhere in the body, elbows are commonplace, shoulders are commonplace, but if it's in your knees or your ankle or whatever, the combination of dry needling with joint manipulation is the best way to resolve your problem, right? So the reason that manipulation is so important is that bones don't move themselves, right? So the elbow joint, the main elbow joint is a pretty solid joint, but one joint in the elbow that really gets severely displaced all the time is the radial ulnar joint, right? So your radius, the head of your radius is right here. So if my hand is the radius, right, on my arm, when I pronate and supinate my wrist or my forearm, the radius comes into contact. So there's 360 degrees of the radial head. It's a circle, right? 270 or so out of those 360 degrees need to come in contact with the ulna to have normal wrist range of motion. So let's just say your supination is limited because your pronator teres is tight and some of your other muscles is tight. If you can't supinate your forearm, you're not going to be able to move your shoulder normally, because when you elevate your shoulder, you need to supinate your arm, your forearm a little bit. So if you have zero supination, when you go to elevate your arm, your acromion and the head of your humerus just got rammed together, and they start to pinch tendons like your supraspinatus tendon, your infraspinatus tendon, right? As far as the rotator cuff muscles go, the supraspinatus and infraspinatus, relatively superficial muscles, right? The subscapularis is one of the biggest problematic muscles following any type of shoulder problem, because the subscapularis is underneath the scapula. So if my hand is the scapula like this, the subscapularis is underneath there, and the tendon attaches right near your pec tendon. So that's one of the many muscles, along with the multifidus and the pelvic floor muscles, and again, any muscle, but especially the deep ones. There is no treatment, direct treatment for any muscle in the body except with a needle. And the deep muscles, if they're chronically aggravated, I just don't think that they respond to normal treatment at all, right? So I think this is unfortunately why so many people are needlessly suffering from little aches and pains, which add up into big overall autonomic nervous system problems. So remember, you guys, if you have enough little pathology throughout your body, right? So if you have a lot of elbow pain on the right side, and maybe some hip pain, and maybe some low back pain and some other stuff, the overall effect on the autonomic nervous system is pushing your autonomic nervous system towards sympathetic hyperactivity and complete disability to regulate itself again, right? So you get autonomic sympathetic hyperactivity. The most parasympathetic dominant places get depressed. Our organ function goes down. Our intestinal motility goes down, right? So aside from directly targeting tissues with the needles, it's always important to directly target the parasympathetic part of the autonomic nervous system. So remember that the parasympathetic dominant areas are the sacral plexus and the muscles they innervate, which are the pelvic floor muscles, so S2 to S4. The upper cervical spine, so the C2 spinous process, or the base of the occiput, because of the cranial nerves, right? Cranial nerve 10, 7, 5. Sometimes they talk about cranial nerve 9. And then the most direct parasympathetic treatment that we have in the body is the ears. So don't forget the auricular vagus nerve distribution in the ears, right? So if you connect those areas to each other and include low frequency periosteal electrical dry needling at the spots where lots of big strong muscles attach, you can make rapid, significant improvements in people's ability to do things like fly fish. So if you can't fish, that's not good, right? So dry needling, again, with joint manipulation, those are the two best ways that we have to normalize tissue length and to normalize the body's autonomic nervous system, right? If our joints are not in place and our muscles are tight and short, nothing else in our body is going to function normally, right? So if anybody has any questions about anything, or if you want to go fishing sometime, let me know. Thanks.